where the goal is to take care of a spinal cord injury patient in the inpatient rehabilitation setting, with a patient that was at high risk for skin breakdown. We wanted you guys to share some of the thoughts you had in working through this pressure ulcer prevention virtual patient scenario, namely things that didn't work and did work from your perspective. If you guys could share that.
So in terms of today, or just in terms of the everything since we've received the material?
Everything.
Good question.
But today as well.
Okay, so I think our first initial encounter where we actually had to make an outline of the learning objectives or what we thought we knew, putting down what we thought we knew, I thought that helped a lot. And then getting the materials based on that information, I thought a lot of the information, the outline that I made was given back to me with all the information that I received, and I reviewed it all. I thought it was really relevant. It was all evidence-based, which is what I kind of wanted. I don't know you guys.
It was useful to do that beginning activity because you kind of tell like what you didn't know, and then focus on when learning through the website, like what kinds of things you should look at.
I also thought it was really good to have the pictures then you can kind of see, okay, the different staging of the ulcers, but based on pictures rather than descriptions, which I think there's a lot more descriptions in the reading rather than like actual pictures of what it would look like. And then the like cost-effective like idea of how you order things and what you're ordering, like to be able to like as soon as you click it be able to see what it was, like whether this was an appropriate or inappropriate, or whether there was actually a better thing to do, a little bit. If you read all of them, there was maybe a better test to order or a better intervention than the one that you had originally clicked. Was kind of good to see almost immediately.
Mm-hmm. And then one negative thing about the materials that we received, I thought it was a lot of reading to initially like read over. But I did like the summary points. I think if you could have better summary points that were like more clinically relevant, rather than the research studies. Like I liked, if I had the time, I'd read. I like that they were available, but I like there to be like a summary point and just like the objective. What should we have gotten out of this research, and how does it apply to us clinically, and how does that how is it relevant to us?
Can I ask a question? Did you keep track just roughly of how long it took you to go through these? You're the first people to go through these materials. So we're trying to gauge, how appropriate it is, if it's too much, if it's not enough. How much time did you spend, and how did you feel about that, I guess?
So for me, I think I spent last night I'd say an hour and a half going through it. I really didn't go through it earlier in the week. So I just started looking for very that's why I was looking for those summaries. So I was kind of scanning through, kind of looking for what was important and looking for what would be clinically relevant to us. Because I felt like I could have taken longer. It could have been 2 to 3 hours if I think read and actually studied the material.
Yeah, I think it could have been to really effectively and thoroughly read it. It would have been at least 2 hours to 3 hours. But I only really wanted I was trying to go as fast as I could through it to get it done in an hour or so, and then I think because of that I ended up losing some of the information that I could have gotten if it was a little bit more concise and more rather than so much reading, more just kind of direct points and images and things like that.
Pretty much agree with both of them. I just sort of scanned through and tried to find the relevant points.
When you were doing the virtual patient today, you saw that you could go back and review it. Did anybody actually go back to the didactics and look to see?
Yeah, I did. At least just to refresh my idea on the staging of this stuff and to know, at least initially going through it. That was, the only thing I really went back through was that.
How easy was it to get back and forth between the virtual patient platform and the online materials?
I thought it was very easy.
I just had the tab open and just left it there in case I needed to, but I actually didn't go back that much, so.
So was the mission of the scenario clear and compelling?
Yeah, I thought so. It didn't really. Well, it kind of makes like having the subject of pressure ulcers. You're kind of looking for it initially, so you're kind of setting us up. I don't know. I feel like if you give like maybe 2 topics or like I don't know, because you're looking for the pressure ulcer, you're looking for the situation, so you're kind of already know the answer, and how you're supposed to treat the patient. So it kind of gave it away, but I guess that's the point of the whole process.
In terms of staging, I feel like there could have been a better job if there was different ulcers and different stages, that you kind of, rather than just being able to notice ulcer versus regular tissue, they were like, if you would be able to differentiate between different stages of ulcers and things like that too, or deep tissue injury, that probably would have been better, because I kind of came away from it being like almost everything would look normal, and then you just, here's one, but it wasn't like you have to test your knowledge of what makes up a stage 3 versus a stage 2 or something like that.
I thought that was kind of strange too. The whole time I was thinking like, this guy's very like everything that we were talking about. Like his risk isn't relatively isn't that high for like a spinal cord patient, and like all the pictures that we saw were all normal. So yeah, I was also just kind of like, well, this isn't really helping me identify ulcers. Like I know it's normal, but like I don't know what the different stages of the ulcers would look like.
So you didn't think that the normal pictures were ambiguous?
No, they. I don't know. I felt like the same thing that they said. I think the point of it, like especially since we're learning about ulcers, I think a good point would be to make stage different ulcers. At least have different stages of ulcers, and then have that feedback. Like I know they had the feedback if you pushed an ulcer that was initially wrong, and then you get that feedback immediately. I like that. I wish that we had more ulcers so we can gauge how we know, like, actually how we can stage ulcers.
I mean, there were times where I would select maybe like stage 1 just because I was like, well, this picture's kind of blurry and this is an ulcer thing and they've all been normal so far. This one's got to be abnormal. And I would click it and I'd be like, oh, I should have gone with my guide.
And then on the last one, I put stage 1. Was that stage 1, right? And I got an X.
I know, me too. That
and
confused me
so
too.
I don't know if that was a problem with the program, but it made me think that I was wrong. So then I went back to no ulcer.
Yeah.
And then
Which one? Which
it was the
when he
the one with the
develops.
stage 1, the heel ulcer.
It's a stage 2.
Oh, it was stage 2?
But it's, the green check
Didn't come
is
up.
on normal.
It was on normal.
Normal tissue.
Oh, okay.
I think one thing that would be useful too is, even for the tests when you order it, if you're clicking a right answer, it should be like a different color, like not red.
Yeah,
because then you have to,
kind of red.
then sometimes it's like, is that right or wrong? You're not really sure, so then maybe you'll order another one. I mean, I guess if you read the whole thing, but basically, the whole explanation can be kind of ambiguous until that one part where it's like, although this is not appropriate, or it's like, although this is appropriate. If it was at least like kind of very clear whether you got it right or wrong.
But this was much better than our initial patient, because I was here when we did ours, like the other one 2 weeks ago, and this was much better than that one, I thought.
Why was it better?
I guess it gave you feedback, direct feedback on those questions, and to basically see what tests were required and what weren't. And so I like that a lot.
Yeah, well, one of the questions I have here is saying, how did you feel about the actions you were able to carry out in the scenarios? And I think you kind of talked about that previously. And were they realistic?
And I think it was good for a resident, because, like, they actually went through writing orders, like a first-year resident or a second-year resident coming to rehab. They had to go through the actual orders.
Like what
and they had
precautions
options of
you
actual
would
orders.
do. Things like that I feel like really important. I mean, as a student, I don't, I guess, know enough about what things you would do.
Think about that stuff, yeah.
Because I haven't really had to think about it doing that, and I think that was useful, especially now that we're going to be starting residency. But once you start, I think that's a good test to know, like, whether you're effectively ordering the right precautions or the labs to start an admission, or even like the radiology, like which tests are really appropriate to begin.
And because I've done the orders here with some of the residents, and all of those orders are listed on their orders, so it's definitely relevant to them, and like any rehab resident.
Anything you'd change as far as that goes?
That was really good. It gave you direct feedback.
Yeah.
And so if you knew if you were ordering the wrong set.
And I like that you were penalized if you order something that like extra that isn't important, then you have to. Then you're like, oh, because I mean, people like me, I feel like function very much on you want to get a good, you want to get a high score, and knowing that you're gonna like, oh, if you, I was very careful about like, do I order this? You know, sometimes I didn't even order enough because I just didn't want to get negative points. But at least it forces you to think very like carefully in terms of cost effectiveness of what studies you order and tests.
Did it work after the fact? Because the way that's set up, you know if you're wrong, but you know if you have committed an act of commission, but not act of omission. So afterwards, the attending gives you the proper order set. Was that understandable or helpful? I'm like watching you from a distance, and I'm seeing this tiny print on the screen. I was wondering if it was useful or.
I used it mostly just to see, because like what Amar was saying before, how it wasn't completely clear, like if you got it right or wrong. I used it just to like see what I had right. I didn't like read the tiny print. I just saw what was there. But so I didn't read like the description.
Kind of see if like you left something out, like oh, and you're reading that thing like oh, this was one of the right ones. Because if you didn't click it, you don't know if it was right or wrong. Exactly. But then that thing kind of tells you what you had forgotten.
How do you feel about the characters in the scenarios? Were they realistic? Did they promote or detract you from your desire to keep looking through the scenario?
No, they were pretty realistic. It was a good patient.
Nothing bad about that?
No, he was a likable guy.
Yeah.
I liked his dog. At one point there was a video of just the dog.
Lunch was an option.
Yeah, get lunch. go see another patient.
Yeah.
Would you guys have wanted more resources? And if so, can you share what type of resources you would like to work through these scenarios better?
I think one thing we could have done is like to give us an actual Braden score to fill out, maybe. Because I think that would be good for us just to see if we could correctly score it. Because I know it's kind of subjective. I don't know if it's an objective test or subjective, like just to see on our guide and based on an actual score, just to see how that goes. And then just if we could probably stage an ulcer, I think if we could, well, we did have that option to stage it.
It could have been more, is what you're saying.
Yeah, there could have been more.
So we could have actually taken this patient and given him a pressure ulcer on every part of his poor body.
Yeah, just for learning purposes. I feel like, if we went through like 5 or 4 at least, 5 or 6 different pressure ulcers, stage them, give the Braden score. I think that would on like a couple of patients maybe to do the Braden score. I think I get a lot more out of that.
Also, I think like for the Braden and the Asia exams, when you could go to that, it was a little bit like there's too many buttons you had to get to that thing. Like there's like, do you want to see another test? You want to go see the whatever happened overnight? Then you go to there. So do you want to see the Asia exam? Then you click that. And then it says, Asia exam was done. Click this if you want to see what it was. And then it was like the 2-page document on something. If at least when you click like, let's see the Asia exam, it would just at least tell you the score. This way, or even for Braden's exam, like the score. This way you can kind of go back to the patient immediately and keep moving rather than. I feel like there was just too many steps to get to like what you wanted.
Although I did think it was helpful to have the option at least to see
the
charts and because I've never seen the like Braden scoring chart and like what it looks like and how you fill it out and stuff. So. Did
you get that it's wrong? I mean, it's partially wrong. It's wrong that the person who filled it out underestimated the risk.
Yeah, because it was 16, I think, out of 23.
Something like that. But so put him in an entirely different risk category. Mm-hmm. But was that too subtle?
That was too subtle. I didn't notice that.
I didn't pick it up until it started saying it, or like later.
Because I was like picking up like through just like clinically relevant stuff, the transfers, the spasticity, things like that. I was just like trying to pick up his risk through that, and because I thought the nurse was correct with the Braden score. I thought it was just going to be correct. I didn't know we'd get a incorrect one.
Should probably make that more obvious. One of the goals is interprofessionalism and working together. Did anybody actually look at the PT video?
I did. It was like 4 minutes long, right?
It was pretty long.
I would like go through and like just look through it.
I did, but the residents started coming in at that point. I couldn't hear what they were saying. I just kind of watched it.
Did you get to it, or did you?
I watched part of it too. I think it was the same thing. Once the residents started coming in, it was kind of tough. But I didn't watch the whole thing.
I think 4 minutes kind of long though, for a video.
Split it up?
Yeah, I'd split it up or just like try to keep it as short as possible to get your point across.
But as far as the resources go that you had even before this, I know you said that you would like to see some of the summary points laid out a little bit betweener.
Yeah. Just to be efficient, you know. Because I feel like we're thinking, what can we do in the shortest amount of time
Yeah.
as possible?
It could be more
Give us a
time
point.
efficient for you.
Exactly.
I mean, there's a lot of material out there, so it's kind of tough to put them in.
Yeah, but just like clinical guidelines, you know, just like give us the guidelines. How are we gonna apply this to work tomorrow?
Because a lot of times when those like salient points get kind of lost in like so much other information that isn't as
Yeah.
important, then you don't come away with those like very important things. You just kind of have like a general, or you. It's difficult to tell sometimes what are the more important things. So if they have like the summary at the end, or even if like it was just made more into like that bullet kind of, rather than like a very, that's like for instance like up to date. Sometimes it's really tough to know like what's really important because they just have so much material to read. Whereas if they have it more in terms of like, these are the salient points, this is what you need to know, this is how you stage stuff, this is how those things work, then you may, this for the same amount of time that you would spend, I mean, if medical students I feel like maybe will spend an hour, and for that same amount of time, then they can really get the most out of that in material rather than skimming it, and not really coming away with all of it.
But it's good though, because you guys made it a point to make it evidence-based, and I like that you had the articles, and I like that you had the research. It's just that if I had the time, I really would, want to read it. But it's just that, maybe it's just because I kind of did it last minute and it was last night, I kind of really want to get the points so I'd be prepared for today.
So if we could just be organized a little better, maybe even in bullet form, and then
Yeah.
having the option to
Exactly.
pull down or see the more evidence
If you
if
don't
wanted
understand,
it.
exactly.
When do you think that this virtual patient training exercise, this experience, will be best in your career as a physician, as a medical student, your first year of residency, maybe when you have a little more experience later as a resident, when do you think that you'd really benefit from this, or someone would benefit from this?
First year resident, or like a fourth year med student, but definitely first year resident for sure.
Beginning of your training.
Yeah, beginning of your training.
I actually think repetition makes things stick a little bit better, so I would even say like if you're exposed to it in medical school and then continue like in the beginning of residency.
And it should definitely apply to your rotation. Like if you're on spinal cord injury, maybe just have a patient, or like like last week, what did we do? Was the autonomic dysreflexia, just like things relevant to that rotation you're on, maybe.
Sure. Do you think that you guys are all fourth years now, and you've seen all across the board of medicine all these types of different rotations, and you have no pressure ulcers, you've seen a few perhaps. Do you think as a third year medical student who's just getting their bearings, that this is something that would stick with them? Or do you think that early in your fourth year that might be a little bit better? You're bombarded with information.
Like for leisurely activity, if this was like required as curriculum, and like had some form of grading, involved in their grading, I think it definitely, you'd pay attention to it a little more. I don't know, if it was just leisurely like this, I don't know how much I'd get out of it, but if it was like a part of the curriculum, I definitely
feel like
we would.
For the staging of ulcers, yeah, that might be useful, but for all the other things with the ordering of tests and precautions, I don't think that would be helpful at all. I mean, as a third year coming out, knowing whether you would get an abdominal KUB, you know what I mean? Even if you guessed that right, I don't know that you would really have. Why? You wouldn't know why you're ordering some of this stuff, or why these different precautions are necessary. I think as a finishing up your fourth year, when you've been exposed to so much and you already have taken all these different exams, you kind of have to know. You have to know, like, I mean, until you really do like step 2, or you do like all these medicine things, you don't really know like what's the protocol for like for kidney stone, what are the best tests you're going to order and what's the most effective. But that's kind of what it's testing, because you can order a test or that's right because that's the most important one, but there's another test that can be used for it that's less sensitive that would be wrong. That's why I think as a resident or maybe late in med school probably would be more useful.
Yeah. Yeah, pressure ulcers you can kind of stage them all over the board if you're not super familiar with them. So learning them sooner might be helpful, but the
Yeah.
actual management of them, you can't take advantage of it. And it makes sense, until a little bit later in your medical school career or right in the beginning of intern year. But so much is happening in intern year that half the time you feel like, maybe you would have been exposed to it earlier. Do you think that this could help people that aren't necessarily in PM&R?
Definitely. I think a lot of people deal with it. You're gonna, at some point, you might have to deal with a spinal cord injury patient, whether you're admitting them or dealing with them medically. So I
Yeah.
think it's
Even pressure ulcers
Yeah.
is no matter what. I mean, your surgery or your internal medicine, any patient who's bedbound, or which is basically almost all patients, then you're gonna have to at least be monitoring for that.
Any other comments regarding your experiences here? Anything else that you would like to see? Or do you feel like you would, now that you've kind of gone through these steps, do you feel like you've retained something here that you would actually take with you?
I think so. I think this is it's a great format to learn. You're not going to actively kill a patient, so it's okay to make a mistake. So you're more willing to actually do what you want without supervision. You're not supervised. So I think it's really just testing your knowledge and testing how you would manage a patient on your own. And it helps a lot for us.
A question, if you had just been given the virtual patient and just as it was and then it has access to the resources, would that have been maybe a better way to focus the resources rather than just to go through the outline on the website?
You mean the resources that we had before?
The website.
The PUP? Or?
Yeah, or you just go in through the virtual patient and then you can pull up the resources inside the virtual patient. I mean, you were already familiar with it, but that first page directed you back to those resources if you wanted to look anything up.
Like an open book?
Yeah, I think that would have been better.
But I think we would still, being in this, we're taking a test setting, I think it wouldn't change the fact that we're just gonna be skimming for, where's the answer, and, not really getting,
Yeah, I mean, as far as retention goes, probably if you're stuck there sitting and thinking about it more and the possible consequences of each of those actions, I think that might help you, really critically think about each of the options, and that might help you retain stuff, right?
Yeah. And just reading last night and then going through it, I was kind of looking for certain things since I read the material last night, and I thought I'll retain a lot of it, just from going through the material twice basically.
And then today.
In that period of time, exactly.
And today you felt like you definitely did.
Yeah, definitely. The Braden score and all of the staging, definitely got a lot out of it.
Somebody said that you were going around with a resident and that the resident was doing exactly what.
Yeah, the orders, I do admission orders on the MSK floor, and those are the same orders, the PT, the PT recommendation, OT recommendations, all the precautions, any labs that you want to order. It's just exactly like the order set here.
So nothing struck you as unrealistic?
No, not at all.
Plus, of course, I've given him a pressure ulcer on every.
Yeah,
Yeah,
if anything,
every
too
surface
realistic,
is by.
because it was almost all normal, and then
Yeah.
there's one small one. In that sense, maybe it would be better to be a little bit unrealistic.
That was stage 2? I could have sworn it was stage 1.
I didn't see
I didn't see any skin
Yeah.
breakdown or.
Did anybody get the other pressure ulcer, the SDTI?
Where was that?
Okay, so the way the program works, the way the platform Decision Sim works, is that you can set some sort of a flag. So you were going to be punished if you didn't review the medical record. If you hadn't reviewed at least 5, you were going to get the worst pressure ulcer. But you guys were obviously conscientiously working through it, so your patient did better. There's an SDTI in there as well.
Oh. SDTI.
What is SDTI?
Suspected deep tissue injury.
For where?
Oh.
Heel. It was all heel.
I feel like the answers were always normal,
Mm-hmm.
right?
Majority of them were, except for that, I guess those
Except that
two.
one heel.
It was all was all kind of oriented toward heel risk.
Yeah.
Because this was actually, so I was worried about realism, this was a
Patient,
real
yeah, I
patient.
saw some of
This
the, I
is a
saw the
real
people
patient.
that were wheeling.
Yeah, it's a real patient,
Here,
but it was
right.
5 years ago, so I was a little worried that the record keeping had changed or something. And he did in fact have a pressure ulcer, not on his heel, but on his toe.
Oh, okay.
Everything that happened was sort of real,
Yeah.
almost, sort of kind of. But your recommendation would be to actually, to get more out of the single exercise by having more opportunity to actually practice the target skills.
Exactly.
And the different types of pressure ulcers. Yeah, sounds like it's all pretty good exercise.
Yeah, this is a really good exercise. Much better than that initial one.
80, yeah, 80 was
80 was
still in the works, it felt like sometimes.
Yeah.
We have a lecture right now, 12 o'clock.
Oh,
Any other closing thoughts or anything, guys?
no.
Thank you, guys.
Thank
Yeah, thank you.
Thank you, madam.
Thank you. And if whatever you have written up, just send it to me. Don't stress out over this whole thing. Thank you.